now?
Yeah. So just go from here and then switch to and switch to the dashboard.
Dashboard, no.
So make sure the dashboard in front of the doctor, and before any time gets into it, you have to go back to you and press L3. Don't do it.
The first question that there was already something is now the question that I've been asked. Yeah. Live well, the caller something already coming. Hello. You're not. There's some previous video is coming, madam. My video, what I spoke the first 20 minutes coming is that whatever I already spoke for the first 20 minutes, that is again being replayed.
On YouTube.
On our dashboard.
So you know that you don't bother. I'm sending the link from backend. Don't worry. That
now can I talk? Start answering.
Yes.
Okay. Okay. Now there's a first question to me from Varsha. Varsha says, when should I see? Just whether it's coming or not, because there's something going on here. There's a first question from Varsha. Varsha is asking me, when should I see a doctor for period problems? So Varsha, the question is that see, if suppose your periods are coming irregular, the normal duration of a pregnancy would be between 22 days. Okay, now Varsha, see, okay. Okay, Varsha, you are asking me a question that when should see a doctor for period problems? Okay, now the answer is that your periods generally, the duration of every period is between, it's actually 20 days. The duration could be at least from 22 days to plus 1 week, so 35 days. Between 22 days cycles regularly, maybe you're getting it once in 2 months or once in 3 months, then definitely you need to consult a doctor. The second thing is that suppose if you're having excessive bleeding, very, very excessive bleeding, where you are generally the normal menstrual flow is around 80 ml. That means you should be a small bottle that you use for medicine. But if it is more than 80 ml, you're passing huge number of clots in your periods, then definitely you must consult a doctor. Okay. Then suppose you have severe periods, you are having severe abdominal cramping and all, and it is not getting relieved with pain, the regular antispasmodics, then also you need to consult a doctor. So that is Varsha's question. Now coming to the second question, a question by Kiara. She says, she's asking me, hi doctor, what happens if you get a vaccine while pregnant? Okay, this is a nice question. See, generally we do not give live vaccines during pregnancy. We give only a tetanus toxoid, and that is how we. This is the only vaccine that we actually give in pregnancy. Like vaccines for rubella and all are contraindicated in pregnancy. Now, Kiara is asking a question. In which month is TT injection given in pregnancy? The tetanus toxoid in pregnancy is given generally when the woman first comes to the doctor, the first dose of tetanus is given. And after a gap of 2 months, at least a minimum 1 month, then we give the second dose. Generally, we regularly follow giving the first dose of tetanus toxoid in the 4th or 5th month, and the second booster dose is given in the 7th month, where we give a Tdap injection. So this is how we plan our vaccination. The other question, I have another question from so I have a question. Why do I have nausea all day while pregnant? So during pregnancy, there's a lot of hormonal changes in the body. There is a hormone called as progesterone, which is produced during pregnancy, which causes a minimal amount of gastrostasis, and this will and any so this because of this there is a high chance of bloated sensation, heaviness, and a high tendency for vomiting. So that is one of the reasons for the hormonal changes in pregnancy will result in nausea. There are certain homemade remedies which you can take to avoid this nausea in pregnancy. One of them could be that you can take ginger, foods rich in ginger, or you can have small quantities of food always. Or you can also have salted biscuits and treacles so that you will not have this nausea. The main simple way to prevent nausea is that yes, I've done now not working properly. So now for period problems, I'm restarting it once again. When should I see a doctor for period problems? అసలు ఎట్లా బాగాలేదు అసలు not is all rotating not rotating. Okay. When should I see a doctor for period problems? There are two times when you should. There are two times when you should mainly immediately just seek for a doctor. When you have bleeding which is more than excess, more the general normal bleeding, and if the patient have excessive bleeding associated with clots, cramping, and all, then she must meet a doctor. And also, really gets too frequent when because or too rare periods. I mean to say that if she has got two times a cycle in a single month, or if she gets periods at very irregular once in 2 to 3 months, then also she needs to consult a doctor to regularize the periods. Next question is there's a question by Kiara who's asking what happens if you get a vaccine while being pregnant. So this I'm answering this question. So So the question is, you can get, you will be, you need to get vaccinated only with the tetanus toxoid during pregnancy. Live vaccines are contraindicated in pregnancy. So during pregnancy, we generally avoid giving live vaccines for fear of having an effect or tetanogenic effect on the babies. So only we give tetanus toxoid. That is the only vaccination that is recommended for pregnant women in India. The other vaccines are not advised. Next, the other question is that there's another question by Kiara. In which month TT injection is given in pregnancy? I'm answering the question. You generally take TT in the 4th month. See, there's nothing fixed specific period that you should give, but in the second trimester, between 3rd to 5th month, we tend to give the first dose of tetanus toxoid, and in the second trimester, we give a Tdap, which is a booster dose for second dose of tetanus is given. So the first dose is given between the 3rd or 4th month, and the next dose is given in the 7th month. This is. There's another question by Kiara. Kiara is asking, why do I have nausea all day while pregnant? So the answer to this is that in pregnancy, there's a shift in the body and so many hemodynamic changes that are occurring during pregnancy. All these hormonal changes in pregnancy feel nothing abnormal that you have nausea in pregnancy. It is a normal physiological change. That's the next bala. So the other question that is asked by Kiara is, this is because Kiran, avatlet Kiran. There's a problem. The problem is this. I don't know what's supposed to be getting hang up. All of them are existing hang up. The question is that why do I have nausea all day while pregnant? This is because of the excessive hormone changes and the heat is being secreted. It all causes nausea during pregnancy. There's a problem with the net and chapter. So the next question. What nausea medications are safe in pregnancy? Well, Kiara, we have this doxinate, a simple medicine, or you can take the Pregnedox, which will actually help you to overcome this pregnancy, nausea during pregnancy. They are simple. We have very simple drugs, or Pregnedox can be taken, or you can take Perinon tablets. What nausea medications are safe in pregnancy? So, okay, I'm re-answering the question again. Simple medicines like Perinom, Semetin, or Doxinate, or Pregnedoxin. These are the simple tablets that we generally prescribe during pregnancy, and they are absolutely safe. But anything you should not take only is absolutely necessary. You take this tablet. What weeks are the worst for morning sickness? It's a question, yeah. And the most important thing is that during pregnancy, the first 3 months are they are the maximum. Where up to 12 weeks, it tends to get better, and the morning sickness definitely improves, and the patient is normal. Uh, Varsha Tiwari is asking a question. Ma'am, is a pregnancy confirmed? Okay, how, ma'am? Okay, if once you, Varsha, the answer to your question is this. Suppose you miss your period. I'm not very good at Hindi, but I'm trying. I got the point that, see, period. Then in the house you can get a urinary pregnancy test done, and as early as the 22nd day, even before you miss your period, you can get a whether you're pregnant or not by radio. Even confirms that you're pregnant. Okay, so that's how it helps to confirm your pregnancy. Now, what can you, Supriya? There's a question from Supriya asking me. What can you take for constipation when pregnant? See, during pregnancy, we would avoid taking drugs. Constipation is a part of pregnancy because of these hormones that are secreted in pregnancy, especially the progesterone hormone, which will lead to pregnancy. So, what medicines you can take is that before you go to the medicines, first you should try the natural methods. Have a little bit of exercise, walking every day. Then take a lot of fruits, vegetables in your diet, which contain fiber. Take at least one orange, one banana, and these type of foods contain fiber and they help in the propulsion of the feces. So even in spite of doing all these measures and water, if you, even if all in spite of all this taking lots of water and these fresh fruits and vegetables and all that, you're unable to get over this constipation, then you need to do you need to take some medicines. They are the you can take a lactulose syrup, and you can have readily available syrups in the smooth syrup form, which is you should take it in the midnight in the evening before going to sleep, and you drink it along with 2 glasses of water. In this food name either smooth syrup, primafin syrup, and all these. Now the next question is: can constipation cause miscarriage? The next one is: I don't think constipation will cause miscarriage, but see, if you go on pressing, increasing your trying to, but I think it's very rare. Constipation will not go to. So the next question to me is: normal to have stomachache during pregnancy? Stomachache during pregnancy. It is not normal to have stomachache during pregnancy. During pregnancy, if any stomachache should be, you should immediately consult your gynecologist. Stay away acidity. It could be due to the a pregnant uterus pushes your stomach up. So because of that, you can have the stomach, or you could have along with pregnancy, you can have appendicitis. You can have some ureteric colic, or you can have some gallstones. So any stomachache in pregnancy should be neglected. You should immediately consult your doctor, and she will advise you what next to do. If you have any problems and all, and you can also consult me on what is SUDP. Now the next question is that morning sickness a bad sign? Priya, morning sickness is no morning sickness a bad sign. No, this cannot be taken like that. Morning sickness is a sign that you are having a pregnancy. That's good. But having no morning sickness is not a bad sign. There are several women who don't have any signs of warm nausea, vomiting, still not a bad sign at all. Now, there's a pregnancy. Uh, you see, there are certain diseases we acquire because of pregnancy. Any medical disorder and associated with pregnancy is a high risk pregnancy. You suppose if you have any viral infections or the pregnancy, they can cause some tetragen, have some bad effects on the baby, and they can cause abortions. Suppose if in order to these not, I don't mean it as disease, but there are certain other medical disorders. For example, if you are having hypertension in pregnancy, that will sometimes lead to cause decreased liquor in the baby, and it will also cause to impaired growth of the baby. It may lead to preterm sudden IUD. There could be a sudden death of the baby inside, uncontrolled hypertension. It may lead to preeclampsia. Mother might throw convulsions, eclampsia, and finally, even the mother's life is put at risk. So one major problem of maternal deaths in pregnancy could be uncontrolled hypertension. Uncontrolled diabetes can also have a toll on the mother. It can lead to increased amount of cesarean sections, because if they are diabetic, then it can uncontrolled diabetes can lead to sudden death of the baby. Uncontrolled can lead to postpartum infections, postpartum hemorrhage. So several other complications. Then other diseases could be that if you're having hypothyroidism, that could also have an impart the growth of can cause and affect the growth of the baby. These are few of the diseases which may harm the pregnancy. Other infective disorders like toxoplasmosis, then toxoplasmosis gone. Certain infections can rubella virus, then you herpes simplex virus. Herpes infections also they are teratogenic and they will cause congenital anomalies in the babies. So these are the things. So we have already discussed these questions, Akita. Which virus can cause miscarriage? The cytomegalovirus. Other organisms are this toxoplasma gondii infections, syphilitic infections are this. So is that can a viral infection hurt my unborn baby? Yes, mostly the mother has got a separates the baby from coming in direct contact with the maternal blood, their sinuses. But certain viruses can pass and they can cause abortions. Supriya has a question. Is it normal to have abdominal taken lightly? If it is in the early first 3 months, it should rule out an ectopic pregnancy. You can have any other problem like a non-pregnant woman. So it's very high probability that it will coexist to have abdominal pain as in a non-pregnant woman. Suppose if you have an abdominal pain in pregnancy, immediately consult your gynecologist. Don't take it in the light. Supriya, is nausea in second time normal? I have a question here from Supriya. Yes, certain women have nausea even until just before they deliver. Also, even the last trimester also they'll be having vomitics. For some, just before delivery, so for some people this nausea might subside. So don't worry. As long as you are having adequately hydrated, don't worry. You can take medication if you are having severe excessive vomitics, and they can be controlled well. Continue. Ma'am, just the question is, ma'am, if I don't know my last period date, then how can I find out when did I actually get conceived and I'm pregnant? Because in May 28th, pregnancy shows positive and ultra shows 7 weeks today. Damn, that is okay. See, this is a nice question by some. What you should do? You must go for a first trimester scan. The first trimester scan is an early scan and 6 weeks. It shows that that is called the dating scan. So if the scan is done less than 10 weeks, so you can add we can very well predict when she conceived. So you can it's called a dating scan. So to know the exact period of gestation, it is always best to get a first trimester scan. And it is two scans, one at 16 weeks and one at 20 weeks, and take the interval growth scan. So when the growth is 14 weeks, the scan was correct. So this is how you estimate the post-probable time of conception. Logic has. And the most important would be hypertension, diabetes, thyroid. If she's previously an epileptic person, if together will definitely affect her health. It is not a single medical disorder. All these put together will definitely cause a health. What diseases are more common in females? So you have the instance of gallstones, then ureteric calculi. These are all slightly at a higher instance in women. So they are commonly seen. So there's a question from Afreen Raza. She says that I want to conceive, ma'am, but my parents are at all. And you can conceive whenever you want. But if you're and since that your periods are regular, that it shows that you're ovulating regularly. If even if you have mild PCO patients generally they conceive just with simple lifestyle modifications, diet, exercise, and adequate sleep, proper diet, and good regular exercises. You do these three things, you will conceive spontaneously. Don't worry about mild PCOS. Several mild PCO patients have conceived spontaneously. So with this, now I would like to end this show, and I would any of the viewers watching this would announce I'm available for online consultation on BabyChakra. My referral code would be SUDP. So those who are interested can want to for online consultation with me. Please consult me on BabyChakra app with my code SUDP. Thank you. And then thank you, Kiran.